A patient comes into the emergency department with what sounds, at first, like a bad viral illness. They have a fever. They have been vomiting. They have a terrible headache. Perhaps earlier in the day they were still talking normally. Maybe they had even been told to rest, drink plenty of fluids, and see how they felt. But now something is different. They are becoming increasingly drowsy. The light in the room is hurting their eyes. Their neck is becoming painful and stiff. They seem confused. And suddenly, what looked like a simple infection has become a medical emergency. This is one of the reasons meningitis can be so dangerous. In this video, I am going to explain the warning signs of meningitis, including some of the symptoms that people may overlook. We will look at what meningitis actually is, what can cause it, how doctors investigate it, how it is treated, and most importantly, what you should do if you are worried about yourself or somebody else. Because when it comes to meningitis, recognizing that someone is becoming seriously unwell can make an enormous difference. Meningitis means inflammation of the protective layers surrounding the brain and spinal cord. These protective layers are called the meninges. You do not need to remember that word. The important point is that the brain and spinal cord sit inside a carefully protected environment. When an infection, or occasionally another inflammatory process, affects the tissues surrounding them, the consequences can become serious very quickly. There are several different causes of meningitis. Viruses can cause meningitis. Bacteria can cause meningitis. More rarely, fungi and other infections can cause it. There are also uncommon non-infectious causes, including certain medicines, cancers, and inflammatory conditions. But from the point of view of an emergency, bacterial meningitis is particularly important because it can progress rapidly and requires urgent treatment. Viral meningitis is often less severe, although this is not always something you can safely determine yourself at home. The early symptoms of bacterial and viral meningitis can overlap. That is why doctors do not simply look at someone and say, "This is probably viral, so there is nothing to worry about." The clinical picture, the examination, and the investigations all matter. So let us start with the warning signs. One of the most common symptoms is a severe headache. Now, headaches are extremely common. Most headaches are not caused by meningitis. People develop headaches from migraine, dehydration, viral illnesses, lack of sleep, stress, and many other causes. The important question is not simply, do you have a headache? It is the whole picture. A headache becomes much more concerning when it is associated with other features such as fever, neck stiffness, vomiting, light sensitivity, confusion, unusual drowsiness, or a rapidly worsening illness. People may describe the headache as severe, persistent, or very different from their normal headaches. Someone who frequently experiences migraine may still develop meningitis, so do not automatically assume that every severe headache is just another migraine, if the overall illness is behaving differently. The next warning sign is fever. A high temperature can occur because the immune system is responding to an infection. But again, fever on its own is extremely common. What matters is the combination. Fever with a severe headache, fever with unusual drowsiness, fever with confusion, fever with a stiff neck. These combinations should make you take the illness more seriously. And there is another important point. Not everybody with a serious infection will necessarily have an obvious high temperature at the moment you check them. Older adults, very young babies, and people with weakened immune systems may sometimes have less typical presentations, so a normal temperature reading should never be used as the only reason to dismiss somebody who is clearly becoming seriously unwell. Another classic warning sign is neck stiffness. When people hear the words neck stiffness, they sometimes imagine a mildly painful neck from sleeping in the wrong position. That is not necessarily what we mean. With meningitis, inflammation around the brain and spinal cord can make movement of the neck painful and difficult. A person may be reluctant to bend their neck forward. They may complain that their neck feels extremely painful or rigid. But not everyone with meningitis will develop obvious neck stiffness, particularly early in the illness. And babies may not show this symptom in the same way as adults. So once again, do not rely on a single sign. The next important symptom is sensitivity to light. The medical term is photophobia. A person may find that normal room lighting suddenly feels uncomfortable. They may want the curtains closed. They may cover their eyes. A bright phone screen may worsen their headache or cause significant discomfort. Light sensitivity can also occur with migraine and other conditions, so it does not diagnose meningitis by itself. But severe headache, fever, and significant light sensitivity together deserve careful attention. Vomiting is another symptom. This can be difficult because vomiting occurs with many ordinary infections. But persistent vomiting alongside a severe headache, neck stiffness, confusion, or increasing drowsiness is much more concerning than vomiting by itself. The pattern matters. The progression matters. And this brings me to one of the most important warning signs of all: a change in mental state. Someone with meningitis may become confused. They may not make sense when they speak. They may seem unusually irritable or agitated. They may appear disorientated and not know where they are. They may behave in a way that is completely out of character, or they may become increasingly sleepy. This is not simply being tired because you have had a bad night. The person may become difficult to wake. They may keep drifting back to sleep. They may respond slowly. Their family may say this is not how they normally are. As a doctor, that sentence is important. The people who know a patient best can often recognize a significant change before anyone else. If someone with an infection is becoming confused, very drowsy, difficult to wake, or unresponsive, that requires urgent medical assessment. Do not simply leave them to sleep it off. Another serious warning sign is a seizure, sometimes called a fit. A person may develop uncontrolled shaking, stiffening of the body, or loss of awareness. Some seizures are less dramatic and may cause staring, unusual movements, or a period of unresponsiveness. A new seizure in someone who is unwell with fever, headache, or altered behavior is an emergency. Meningitis can also sometimes affect parts of the brain or occur alongside inflammation of the brain itself. A person may develop weakness, problems speaking, unusual behavior, or other neurological symptoms. These symptoms can have several possible causes, including stroke, but they always require urgent assessment. Now let us talk about the rash. This is probably one of the biggest areas of misunderstanding around meningitis. Some people believe that meningitis always causes a rash. It does not. Some people believe that they should wait for a rash before going to hospital. They should not. A rash is particularly associated with meningococcal disease, where the bacteria can enter the bloodstream and cause a life-threatening condition, sometimes described as meningococcal septicemia or sepsis. The rash may begin as small red or purple spots. It can spread and become larger areas of discoloration or bruising. One commonly discussed method of checking the rash is the glass test. You press the side of a clear glass firmly against the skin and look through it. A concerning rash may remain visible and not fade under pressure. But here is the message I want you to remember. A person can be seriously ill before the rash appears. Some people may never develop an obvious rash, and on darker skin tones, changes can sometimes be more difficult to see. So do not wait for a positive glass test before seeking help. If a person is seriously unwell, the absence of a rash does not make meningitis safe to rule out at home. There can also be warning signs that suggest serious infection in the bloodstream rather than inflammation around the brain alone. These may include very cold hands and feet, severe muscle or limb pain, pale or mottled skin, rapid breathing, and a person who seems to be deteriorating rapidly. Meningitis and sepsis can sometimes occur together. The person in front of you may simply look extremely ill. Never underestimate that observation. Medicine is not only about individual numbers. Sometimes the overall change in a person's appearance, behavior, and level of responsiveness tells you that something serious is happening. Now, babies can show meningitis differently. They cannot tell you that they have a severe headache. They cannot explain that light hurts their eyes. They cannot tell you that their neck feels stiff. So parents and carers need to look for changes in behavior and appearance. A baby with meningitis may be unusually sleepy or difficult to wake. They may be very irritable. They may have a high-pitched or unusual cry. They may feed poorly or refuse feeds. They may vomit. Their body may feel unusually stiff or, in some cases, unusually floppy. They may develop seizures. The soft spot on the top of a baby's head, known as the fontanelle, may sometimes appear bulging. But just as with adults, not every symptom has to be present. Parents often know when something is wrong with their child. If a baby is becoming difficult to wake, not feeding, breathing abnormally, having a seizure, developing a concerning rash, or simply appearing seriously unwell, seek urgent medical help. Teenagers and young adults are another important group. Young people can be healthy one day and become seriously unwell surprisingly quickly. The early symptoms may initially be dismissed as flu, a hangover, exhaustion, or simply wanting to stay in bed. If a teenager or young adult develops a rapidly worsening illness with severe headache, fever, vomiting, neck stiffness, confusion, unusual sleepiness, or a concerning rash, do not assume they simply need more sleep. Check on them, speak to them, make sure they are responding normally. And if you are worried, seek medical help. So what causes meningitis? Viruses are a common cause. Several different viruses can inflame the tissue surrounding the brain and spinal cord. Many people with viral meningitis recover with supportive treatment, although some may still become very unwell and require hospital care. Bacterial meningitis is generally more concerning because it can progress rapidly and cause severe complications. Different bacteria can cause it. The organisms involved may vary depending on a person's age, health, and other risk factors. Meningococcal and pneumococcal infections are two important examples. Some bacteria can live harmlessly in the nose or throat of healthy people, but under certain circumstances, they can invade the bloodstream or reach the tissues surrounding the brain. Vaccination has played an important role in reducing some forms of meningitis. However, no vaccination protects against every possible cause, so being fully vaccinated reduces risk but does not mean that meningitis becomes impossible. Fungal meningitis is much less common and is more likely in certain people with significantly weakened immune systems, although the exact risks depend on the organism and the circumstances. There are also rare non-infectious causes of meningitis. But if someone arrives in hospital with symptoms suggesting acute meningitis, the immediate priority is often to identify or treat potentially dangerous infection. So what happens when someone comes to hospital? The first step is rapid assessment. Doctors and nurses will check the person's vital signs, their temperature, blood pressure, heart rate, breathing rate, oxygen level, and importantly, their level of consciousness. We will examine them for signs of meningitis, sepsis, and other possible causes of their symptoms. Blood tests are usually taken. These can look for signs of infection and inflammation, and check how the kidneys, liver, and other parts of the body are functioning. Blood cultures may be taken to look for bacteria in the bloodstream. But one of the most important investigations in suspected meningitis is often a lumbar puncture. This is sometimes called a spinal tap. The name can sound frightening, so let me explain what it actually involves. A thin needle is inserted into the lower part of the back to collect a small sample of the fluid that surrounds the brain and spinal cord. This fluid is called cerebrospinal fluid. The sample can then be examined for signs of inflammation and infection. Tests can help determine whether the pattern is more consistent with bacterial meningitis, viral meningitis, or another cause. Modern laboratory techniques may also look for genetic material from particular bacteria or viruses. A lumbar puncture can provide extremely valuable information. However, it is not always performed immediately. In some patients, doctors may need brain imaging first. For example, there may be concern about significant pressure inside the skull, a mass, certain neurological findings, or another reason why a scan is needed before proceeding. The important principle is that necessary investigations should not cause dangerous delays in treatment. If doctors strongly suspect bacterial meningitis, treatment may need to begin before every test result is available. This is one of those situations in medicine where we may have to treat first while continuing to establish exactly what is happening. Suspected bacterial meningitis is usually treated with antibiotics given directly into a vein. The exact antibiotic choice depends on factors such as age, local guidance, allergies, and particular risk factors. In some situations, additional antibiotics are used to cover specific bacteria. A steroid medicine may also be given in certain cases to reduce the inflammatory response associated with bacterial meningitis. Patients may need intravenous fluids, oxygen, and careful monitoring. Those who are critically unwell may require treatment in an intensive care unit. If doctors suspect that a virus such as herpes is affecting the brain or its surrounding tissues, an antiviral medicine may be started. Fungal meningitis requires specific antifungal treatment, so there is no single treatment for every type of meningitis. The treatment depends on the cause, but the central message remains the same. When dangerous bacterial meningitis is suspected, treatment is time critical. Why are doctors so concerned about it? Because meningitis can cause serious complications. These can include seizures, hearing problems, neurological disability, problems with memory or concentration, and in severe cases, permanent brain injury or death. Meningococcal infection in the bloodstream can also cause severe sepsis, shock, and damage to multiple organs. This is why doctors take suspected meningitis so seriously. Now, let me give you a practical way of thinking about the warning signs. Do not try to diagnose meningitis at home using one symptom. Instead, look at the pattern. Ask yourself, is this person becoming rapidly more unwell? Do they have a severe headache that is unusual for them? Do they have fever or signs of infection? Are they vomiting repeatedly? Is their neck unusually stiff or painful? Are they finding light extremely uncomfortable? Are they becoming confused? Are they unusually sleepy or difficult to wake? Have they had a seizure? Is there a new rash that does not fade under pressure? And perhaps most importantly, is something about this person making you think this is not a normal illness? You do not need every symptom. The symptoms can appear in different orders. The illness can change over time. A person may not look the same 2 hours later as they did when the symptoms first started. That is why reassessment matters. Perhaps somebody was given advice earlier in the day. Perhaps they were thought to have a viral illness, but now they are worse. That earlier assessment does not mean you should ignore new warning signs. If the situation changes, seek medical help again. And if you think someone may have meningitis and they are seriously unwell, do not wait until the morning. Do not wait for a rash. Do not wait for every classic symptom. Do not leave a confused or very drowsy person alone to sleep. Seek urgent emergency medical assessment. And if you are uncertain but concerned, seek urgent medical advice rather than trying to confirm the diagnosis yourself. You may also hear about close contacts of somebody diagnosed with meningococcal disease being offered preventative antibiotics. This does not mean that everyone who has briefly been in the same building automatically needs antibiotics. Public health teams and medical professionals assess who is considered a significant close contact and advise accordingly. In some situations, vaccination may also be recommended. So if somebody close to you is diagnosed with meningococcal disease, follow the specific advice given by the medical or public health team. Do not start taking leftover antibiotics from home. Do not share antibiotics. And do not assume that taking a random antibiotic will prevent or adequately treat meningitis. Appropriate treatment depends on the organism and the clinical situation. I also want to address one final misconception. People sometimes imagine that meningitis always looks dramatic from the beginning. It may not. The early illness can resemble something much more ordinary: a fever, a headache, feeling sick, muscle aches, tiredness. The danger is not that every person with these symptoms has meningitis. Of course they do not. The challenge is recognizing when the illness is moving in the wrong direction. The headache is becoming severe. The person is becoming confused. They are becoming difficult to wake. Their neck is becoming stiff. They cannot tolerate light. They are vomiting repeatedly. They develop a seizure. A concerning rash appears. Or they simply become dramatically more unwell over a short period of time. That change is important. So here are the most important things I want you to remember from this video. Meningitis is inflammation of the tissues surrounding the brain and spinal cord. It can have several causes, including viruses and bacteria. Bacterial meningitis is a medical emergency and requires urgent treatment. The warning signs can include severe headache, fever, neck stiffness, vomiting, sensitivity to light, confusion, unusual drowsiness, seizures, and, in some cases, a non-fading rash. But symptoms can appear in any order. Not every person will have every symptom, and you should never wait for a rash before seeking help. If somebody is seriously unwell, babies may show different signs, including poor feeding, unusual irritability, excessive sleepiness, a high-pitched cry, stiffness, floppiness, or seizures. And in any age group, a rapidly deteriorating person should never be ignored. The purpose of knowing these symptoms is not to make everyone frightened whenever they develop a headache or fever. It is to help you recognize when an ordinary-looking illness may be becoming something more serious. Because sometimes the most important decision is not making the diagnosis yourself. It is recognizing that something is wrong and getting the person to the right place quickly enough for doctors to investigate and treat them. I am Dr. KDM. I am an internal medicine doctor based in London with over 15 years of experience as a doctor. My aim on this channel is to help you know the warning signs of serious illness, detect when something may be wrong, and understand how these conditions are managed. If you found this video helpful, please consider subscribing. And remember, with suspected meningitis, do not wait for every symptom. Do not wait for a rash. If someone is becoming seriously unwell, seek urgent medical help.